The federal government in 2022 revealed that Nigerians spend about $1.6 to $1.6 billion dollars on medical tourism annually. This figure, equivalent to 664 billion naira per year, can be reduced when individuals access medical care from some of the top-notch medical facilities in Nigeria whose services are similar to those abroad. In line with medical interventions and standard healthcare services in Nigeria, Dame Irene Okwuosa Memorial Hospital, located at Irefi Orifite, Anambra State, provides patients with the highest quality and safest care possible.
I feel very, very good because before this time around, the thing was too bad for me. In fact, I didn't know that kind of a thing can be changed. And somebody will remain the way I am now. Because then I can move 1 kilometer move from here to the other step. I will be feeling too much pain in my heart. So, and the day the one Dr. Meka Eze told me about the foundation, then I came here and was registered as one of the people that is going to be operated on. In fact, I was very, very happy. I feel like a new man because I don't know that I can return to the normal life again. I was thinking that I would just from here and pass away. Then this thing, the way the doctor told me is going to be working on me, shows that it's like a new heart was putting on me, meaning a new life. So I feel very, 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 very happy, extra happy. To the foundation, I'm very, very happy. And I pray to God to keep giving them the more knowledge or vision to know how to help other people to get well again. Because this part of the world, things are very hard. To get such amount of money to go and do the surgery is not easy. Then seeing the foundation doing it free for you is fantastic.
With a specialty in cardiology, this well-equipped hospital performs open-heart surgeries, and in November 2022, they set a track record of performing 25 surgeries on 24 patients within 12 days with 0 fatalities.
So here you do basically interventions to the heart, to the blood vessels. Here you look at the heart supplies the body. Now the heart also has vessels that supply itself. So here you can look at the vessels that supply the heart while the heart supplies the body. When I mean supply, I'm talking about blood supply. So here you do repair for vessels that are narrowed, you call stenosis, or vessels that are dilated, you call aneurysm. So here, this is where you do all the repair for that. So basically for people having a heart failure or heart diseases, various heart diseases, whether left or right heart disease, this is where you do the repair. This is where you do the diagnostics. So when I mean repair, we'll call it a therapeutic procedures. Then I talk about diagnostic or visualization, you call it diagnostics. So here we have, basically we work with catheters. So we have diagnostic catheters there, and we have therapeutic catheters there.
All right.
The experience has been quite nice, actually, because we have had an opportunity to work in an environment where the resources sort of mimic what we are accustomed to in the United States. All right. Well, that is twofold. Firstly, the fact that the hospital is a nonprofit entity that was established by an individual who feels like he has some contributions to make in the society to provide good services is rather encouraging. And this is definitely something that we can identify with in our organization, Improve Foundation. And we have access that is made available to even indigent patients who otherwise would not be able to afford having this sort of quality care. That also is something that we find rather encouraging. Irene Okwuosa has literally created an environment where Boom Foundation can quality care, especially in cardiac surgery, without any sort of intrusions on his part on how we select patients that are taken care of in this environment. Well, last year's account, maybe about 200 open heart surgeries were performed in a country where, if you contrast that to what happens in the United States, where an average hospital does far more than 200 cases a year. I live in a very small town in Texas, where there are two major hospitals, and it's a very small town of 125,000. Yet open heart surgery has been done there, and each program doing over 300 cases a year. So you can see whereas we are celebrating the fact that we have accomplished quite a bit in Nigeria, we haven't scratched the surface. And so imagine what would happen if there were many Okwuosa type individuals in this country. Our nation is blessed with people who have the means to do so, but only very few think that they can make a difference in providing care that can take care of themselves, but also maybe extend to other people.
The Dame Irene Okwuosa Hospital fully commits itself to complementing government's efforts towards reducing maternal and child mortality, controlling the spread of preventable diseases, providing access to affordable and safe surgery for the removal of tumors considered inoperable by most hospitals in the country.
I feel good and happy. In fact, I don't know what to say than to say thank you to God. God has done it for me because sometime last week, it's like I'm a dead person. But God made it possible for me today to be alive. Well, I can't thank Irene Okwuosa. I've been praying for him. God, the man wants to save life, and he's saving life already. For the fact I'm among people that he saved life, God will always bless the foundation. The foundation will do more than this because they have vision. God will give them vision and money to do it. May God bless him.
In partnership with the VOOM Foundation USA, they've provided community care services, medical missions, as well as donation of easy-to-use drugs to healthcare centers for the fight against diabetes, colon cancer, malaria, cholera, arthritis, and typhoid.
The cooperation we have between Irene Okwuosa Foundation and VOOM Foundation is quite unique. Unique in the sense that each entity has been striving to do the best in what we set out to do. So it's actually a meeting of common minds. VOOM Foundation, as I've stated earlier, they have been on this within Nigeria. And when I got to see what they've done so far, and I also have seen the flip side of it, and what do I mean by the flip side? The fact that some of the activities they've been involved in, they have not gotten the right response by the cooperation of the entities involved and by the sustenance. When we teamed up with them, I made up my mind that those gaps must be bridged. And I'm glad to say today that VOOM Foundation and Irene Okwuosa Foundation, we have been working successfully in a single direction. They have brought in here human capacity. They brought in here materials to support us. They brought in here equipment to support us. We have invested a lot in equipment, a lot in materials. So we are working very closely together. You can see the quantity, the number of people that will come from all over the world and come and stay in a town that is not really an urban town, spend 2 weeks here, put in all their time, day and night they're working. I mean, it makes a lot of difference. It requires a lot of commitment. I believe that the future of this arrangement we have is quite very good, and we will take it further to greater heights.
VOOM Foundation is a nonprofit organization. It's a 501c3 organization that was started in 2004. The sole purpose of the organization is to do what we can to raise the standard of healthcare in Nigeria. Our primary focus, obviously, is indigent patients. Yet we know that when we come here to operate, we don't, close the doors to other people who cannot, benefit from what it is that we're doing. Frankly, yeah. So will focus on indigent patients, but the care is available to all. And so VOOM Foundation brings not just the expertise. Ours is a volunteer-driven organization. So when we show up here, with all kinds of specialties that are necessary to deliver, safe, quality care. We bring other resources like consumables and equipments, to match whatever it is that the local host provides to allow us to be able to conduct our work. So our job doesn't end with just folks showing up here, but we bring the necessary tools, valves that we place in patients, oxygenators that are donated through industry partnerships and things of that nature. So yeah, there's a whole lot that we bring into the country because to conduct open heart surgery in a nation where very little is produced requires a lot of resource. And as you can imagine, in the United States, open heart surgery costs about $100,000. And yet, in this country, is a tiny fraction of that people actually get to pay once it is a VOOM sponsored program. And the reason is because we bring resources. And then our local partners provide the enabling environment for us to be able to conduct this surgery. Irene Okwuosa identifies with our vision, providing care to people who can afford it. You and I will agree that most Nigerians cannot afford to spend $12,000 to get one surgery when only very few make that amount of money in a year.
Like last year, I'm suffering. I don't know what is happened to me. I went to UNCH. So Dr. Nonso directed me here. So I came here. They confirmed that I have a heart problem. So they started treating me like up to date. Now I'm getting myself. I don't have a new life. I have a new life now. God have turned my life into a fresh one. This is 1 week now, but everything is better now. Let God take control over this foundation because it's very, very important. God has used it to surprise people, saving life. So let the owner of this foundation, God give them more long life. All the workers, God reward them.
Do this as we do this twice a year, and we're here for 2 or 3 weeks. It's impossible to take care of everyone that needs care, everyone that you want to take care of. We try to select patients carefully, patients we think will benefit from surgery, but also patients we know that will likely not survive if we do not operate on them during this period of time. So we have a wide variety from low-risk patients to moderate to slightly high-risk patients. We don't operate on patients that we do not feel that we have the resources or the equipment to take care of while we are here, because then we'll just do harm. But our selection of patients is varying based on. So I think that one of the important things about this partnership is the vision of the foundation as well as the vision of the VOOM Foundation. Once upon a time, medical missions came to the country and operated on patients, and the skills were not transferred. One of the important things of our organization was not just to operate on indigent patients, but to transfer our skills. So to teach Nigerians to operate so that one day when or if we're not here, they can do it without us. And that was the vision of the foundation as well. So we have a physician here who's a cardiac surgeon who's training with us, who will one day do this independently without us. And we continue to hope to grow that in numbers of missions we do a year.
The selection of patients is based primarily on medical grounds. Then patients who come in from both the VOOM Foundation, Irene Okwuosa Foundation, are assessed in this facility by specialists, cardiovascular specialists, and difficult cases are then selected, right? So criteria based on not just what the patient has, that is the diagnosis of the patient. Will this patient do well if operated upon? After surgery, what is the health-related quality of life post-care? What is the patient's prospects after surgery, to the family, to the community? What are the chances of the patient surviving the surgery? Then Beyond that, also other social aspects come in, which is also part of the clinical assessment. How do we define the underserved communities who, if this mission, irrespective of this mission, can get access someplace else in the country or somewhere else in the world? Who needs it the most? So those are all parts of what goes through our process of patient selection. Then we also factor in, even when we have cases that are quite bad, that not necessarily we might not be eager to operate, and we factor in how long would these patients live if we don't intervene. So those are all the steps that go into the patient selection process. We have a dream, we have a vision of what we want to create in here. We want to create first affordable, accessible, and available high quality healthcare.
Let me start by appreciating the chairman of this hospital, Emeka Okwuosa. I don't know where to start. This is a world-class hospital. I've seen different hospitals. I've been privileged to go outside the country, but here it's happening here live. For this mission, we've done up to 12 open heart surgeries. You can't get it anywhere in Nigeria now. It's a very good one for this hospital. So that's going to help our indigent patients here in Nigeria. For them to get the money to travel out of the country is not easy. But our chairman had made it possible that our indigent Nigerian patients can come here and do open heart surgeries most of the time free of charge. And kudos to him. We pray that God will keep him alive and will continue to help poor Nigerians. But for us here in pharmacy, our goal is to give our patients quality medical care. Instead of all by providing quality medications. So our patients get quality medications and we still monitor those drugs. We don't just give drugs and go. We continue to monitor the drugs while they're here in the hospital, even when they have been discharged. We continue to monitor them. So they're very good, they're in good hands. And I still thank our John for making it possible for us to get quality drugs. Each time we need drugs, he made them available.
The value for life and well-being cannot be overemphasized. A testament indeed to more possibilities of improved health care in Nigeria.
It's good to know where we're coming from and where I'm coming from. And it's just about basically a life of empathy. It's a life of making a difference and a difference, positive difference in the lives of people across the board. That's been the driver of the entire thinking. And when you look at the healthcare delivery we're talking about, for which we are talking about the Irene Okwuosa Memorial Hospital and all the activities that we carry out there, and most importantly, the open heart surgeries that are being conducted here, giving people, so to say, their lives back. It's a thing of joy. I mean, some experience we've had here based on past activities, based on past surgeries that have been done here, it's good to see even young kids who prior to that could not live a normal life. You see them smiling, jumping, and being able to actually be human beings again. There's nothing more joyful than that. So for me, it just shows also, it's one of the few indicators that what we're doing is working and that we're making a difference in the lives of people. Of course, when I set out to look at healthcare delivery, I already started doing things in other sectors, education, provision of infrastructure, water, what have you. You know, I wanted to make a difference because in this sector because I could see the massive gap in healthcare delivery in Nigeria. It's a big challenge, just like you have in developing countries, but ours, the gap is massive, massive, so to say. I started by just trying to build a hospital that would provide primary health care and general medical, treatment. But as we commenced that process, Providence put us together with VUM Foundation. I got to know Dr. Vincent Ohaju, who is the proprietor of VUM Foundation. VUM Foundation It's a foundation based out of College Station in Texas, United States of America. But they have been involved over years with carrying out support systems for medical institutions in Nigeria, particularly in the area of open heart surgeries, all manners of cardiothoracic procedures, mostly to people who ordinarily cannot afford those. So when I linked up with him, he encouraged me to look into putting together what you have seen here. I caught up with that, and the rest is history. It took us a couple of years to completely reconfigure here and put state-of-the-art equipment and facility. And like it's typical for me, anything I want to do, I want to make sure I do it the best possible way. So we broached no consideration besides getting this place to be the best that you can see anywhere in the world. So that is the motivation. Motivation originally, if I may repeat, is to build a medical facility, but we ended up with a hospital that handles cardiothoracic as well as general specialties, and that's what you have to do.
Do like and subscribe to Anido TV for more Igbo-centric contents.